I always like to pray for our classes. So Heavenly Father, we thank you. We thank you that you have shown up into this place, into Healing Hands Chiropractic. And thank you for the souls that you have before me. And thank you for their journey of health and healing upon their bodies, Father God. That you have made us, and we are fearfully and wonderfully made, Lord Jesus. And Lord, I ask you to work through me. May it be your words, not my words, Father. May it be your knowledge, and may people be receptive to hearing the story of their bodies and their health and healing. In Jesus' name.
Amen.
All right. You're in the spit zone. You're in the front row.
Oh, wow.
All right. We have a balloon here. Throughout the, how am I going to do that? Throughout the evening, I'm going to keep making this bigger. So I'm going to have to let the air out, but I'm going to keep making it bigger. This is representing your body. Inflammation and your body, and how it's affecting your body. So, anti-inflammatory. Our goal for this year is reset and thrive in 25. So we found out that inflammation, or it has been known that inflammation is the cause to all disease. That it all starts with something being inflamed that starts the process of disease, any disease. Now most people think of inflammation as part of joint aches and pains, but it's more than that because all diseases is based on inflammation. So let's go all the way back to what is inflammation. It's the body's response. It's the body's response to something foreign, number one, to an injury that has happened, be it an external or an internal injury. And so I figured the fact that you're here, you've been diagnosed or someone's told you you have inflammation or you feel inflamed. Well, it's more than just that. So our body sends our signal from our brain, down our spinal cord, out our nerves, to our organs, to our tissues, to our muscles, everywhere. What happens is when the stimulus happens or the injury happens, if it's not taken care of immediately, it's going to persist and it's going to cause decay. So how does the inflammation process start? Normal tissue. We have normal tissue. You're born, hopefully an easy birth. We were all there, right?
Yeah.
But do you remember it? No, you know stories. So we have our normal joints, and they start to develop as we grow up. They should be moving freely. That's the way it should be. Our nerves, the connection between our brain and our body should be happening correctly. Blood flow, and there should be no pain in the body. So acute inflammation happens. It's our body's response. And then it becomes swollen and red. So you fall. You're learning how to walk and you fall onto your knees. Had a little boy today. He is 6. And he fell on his knees. Like, don't adjust my knee. It hurts. I fell today on the playground. And I said, I won't. Actually, if I adjust it, it'll recover quicker. But I'll go into that in a little bit. So the area becomes swollen and red. With that, function starts to get decay or to slow down, but how it's functioning, be it a joint, be it an organ. The nerve becomes compromised, and then pain starts the process. So then it doesn't get taken care of. You think, oh, I fell on the ice. I came down on my behind. I didn't think about it. Well, if you come down on your behind, I want you to picture that. You slip on ice, you come down on your behind. Yeah, I see your faces. We've all done it. What happens? You think that jars our spine?
Boy.
Yeah, you can feel that, can't you? Yeah, it doesn't feel so good. So that starts a chain reaction. The joints start to break down. Arthritis starts. We'll get into more details. The tissues start to decay. Cardiovascular disease, gut issues. If you came down on your behind, the nerves that are here in that lower area are going to compromise those internal organs. Disease and dysfunction. Your body is now fighting harder, so it's tired. It's working harder to fight whatever it's trying to heal. And then pain becomes constant. Now pain is typically what brings people into a doctor's office, right? You don't feel good. Pain is the start of the process. So, we have our balloon. Told you guys were in the front row. You're in trouble. Not yet. I'll tell you when. So the body starts getting inflamed. I hope you know who Jack Benny is. I figured. For those that don't, I am sorry. Look him up. He was an entertainer. So arthritis begins. I'm going to go with the physical outside. Imagine again, slip on the ice, feel that pain right in the behind, jars the spine, you don't think anything of it. A couple of years later, things start showing up. It's hard to get out of bed or out of your chair. The legs get heavy and stiff. You can't move quite right. And then internally, what starts happening is you can't eliminate your bowels fully. It doesn't feel like you're clean. Or your bladder starts to leak. Osteoarthritis is another name is degenerative joint disease. You go to the medical doctor and they take an x-ray, or they don't even take an x-ray and they say, oh, you have arthritis, you have to live with it. Have any of you heard that word before, or that statement? You have to live with it. I'm telling you, you don't have to live with it. So it's the decay of the joint, be it in your spine, be it wherever there's been an injury. So again, we're going to go back to that behind. So it shifts the sacrum, this bottom bone right here, so that I don't have my spine. I mean, I have my spine, not my model. It shifts. And then the vertebra shifts. And that's the subluxation. That's what we're looking for as chiropractors, that subluxation, that misalignment. So then the cartilage starts to break down because it's wearing funny. It's not sitting there. That would be great. So it's wearing funny. And then we had a question for our candy giveaway. Yes, it was candy, I'm sorry. It wasn't healthy. But our question was, when does arthritis start? Well, within 48 hours of an injury, arthritis will start. 48 hours of any injury, arthritis will start. Because the bone has shifted and it just starts wearing funny. But you're still moving, you're still living your life, but it's wearing funny. It shows up on an x-ray at 5 years. That's when we see the first incident of arthritis. Now, I say that's what they say. But he was four. I had a child a couple of years ago, many years ago, all out of control, ADHD, just off the walls. He was in here all over the place. Single mom, she just didn't know what to do with him. So he was everywhere. Well, I took an x-ray of his spine because she brought him in for ADHD. I took an x-ray of his spine and he had a reverse cervical curve. His neck was going in the opposite direction at the age of 4 or 5. And that was the first incident I saw of a spur on a 4-year-old's neck.
Wow.
That had developed. And I'm like, what happened here? Well, because the mom couldn't handle, like just couldn't control him, what did she do with her phone? Here, here, to occupy him. What does the society do with their phones? Where do they put them?
Pocket.
No, when they're looking at it. They're looking down. It's causing the reverse cervical curve. So started adjusting him, and he started calming down. He started being able to focus. He would love coming here, and then they moved away. So, I know. So then rheumatoid arthritis. I have some patients, and maybe you have friends that have been diagnosed with rheumatoid arthritis. That's the body attacking itself. Again, it starts with misalignment, and if they see it's an autoimmune disease, but it starts decaying the joints. Mostly the hands. You see the people that have the fingers that are bent in all directions. But it's not just on one, it's bilateral. That's how one of the telltale signs of rheumatoid is that it's on both sides. It's not just one side. It can also affect the organs. And then psoriatic arthritis, another autoimmune. Don't hear this as much, but have you heard of psoriatic or psoriasis?
Yeah.
That's a skin issue. It goes with psoriatic arthritis. They're partners together. Well, this is another class that I'll do, but that's all gut related. That's happening here in the gut. That's affecting the outside. So obviously, all of these are inflammatory processes. So what are risk factors? What controls are getting it? Well, I am sorry. Wah, wah, wah. Age. These numbers have changed. It increases as you get older. The average age is now 55 for arthritis diagnosed. 55! When I read that, I was like, oh my gosh, that's one more year. But I've had arthritis since my 20s because I was a gymnast. Oh, headstands, falling on my head, falling off of a balance beam. You think that started a process of arthritis? I didn't know about chiropractic till I was 21. So then, lifestyle. What we put in our bodies is going to affect arthritis. How much inflamed are we? So obviously, diet, exercise, how active are you? Stress management, that's another talk we'll do this year. Genetics, yes, it does play a role. But doctors will say, well, did your mom have arthritis? Yes. Then you'll have arthritis too. No. Don't let that be the death sentence, because it's not. It's not. Weight. The more weight, the harder it is for our joints to work. The harder it is for our bodies. Fat cells produce chemicals that are detrimental to our body. Our injury history. So again, I'm going to go right to the first thing of introduction. Birth. Do you think birth is easy? For you men, is birth easy?
I'll let you know next week.
Okay. I'll give you a hint. It's not. Now, this is a male pelvis. No baby's head is being pushed through this pelvis, but baby's being pushed through. If it's in the right position to be pushed through, head down, facing, well, I don't remember all the words. So coming through, has to come out. Babies get stuck. Doctors need to twist and turn the neck. I watched that with my grandchild. I watched the midwife turn her neck and pull her. And I'm like, yeah, it was a little traumatic. And that was an easy birth. The mom might not agree. But it happens, injuries happen early. Did every child that walked not fall? No. They're coming down, they're getting jarred, they fall off of things. It's going to happen. So those things accumulate, and then all of a sudden, you're in your 50s, and you're like, oh, I'm getting old. Can't get out of the chair. Oh, sitting on the toilet, coming back up. Oh, I feel old. Well, you're reinforcing that by saying it, because what comes out of our mouth is going to happen. But it starts early. And then you start thinking about, I remember swimming when, I don't even know how old I was. I'm swimming in the swimming pool underwater. My head hit the concrete wall.
Oh.
Exactly. I mean, I remember that. I've had, as a teenager, multiple accidents. I'd been, obviously, a passenger, but I remember getting hit from behind in the head doing that. I was a teenager. I was 14 years old. So all those injuries start to build up, and then one day, oh, doctor told me I had arthritis. I have to live with it. Well, we can see a history, but we can slow it down. So besides you know people that have been diagnosed. Don't let it be their death sentence. Don't let it be their death sentence. So what are traditional treatments? Throw some out. When you go to a medical doctor, if you have arthritis, what are they going to do?
Pain relievers.
Medicine, aspirin, Tylenol.
Do they use steroids?
Steroid, shots.
Physical therapy.
Physical therapy, yes. So any medication, be it an aspirin, be it a Tylenol, is going to have a side effect. It's changing your body's chemistry, making it abnormal. Your body's doing the right thing by causing the inflammation, but it's making it abnormal. So then they're going the higher drugs. Oh, I just read this article this morning. How Walgreens, I don't know if anyone heard this on the news, Walgreens now has to pay back some millions of dollars back to the government. You read that. Because of the opioid crisis, because they were filling prescriptions knowing that they actually weren't from medical doctors, and they were filling them, charging the government to pay them, because it was under Medicare, and how they have to pay now the government back for that money, besides causing the opioid crisis. Yes. You mentioned physical therapy. There is nothing wrong with physical therapy. But I always say, why put the cart before the horse? What does that mean? It means if a bone has been out of alignment, I'm going to say since you're a teenager, and then they build up the muscle around that bone that's out of alignment, what's going to happen?
It gets worse.
It gets worse. It gets stuck there. It becomes permanent. So why don't we get the nerve pressure off and get that bone back into alignment, and then let's strengthen it. But medical doctors will say, go to the physical therapist. Will they say, go to the chiropractor?
No.
No.
No kickback.
No kickbacks. Lifestyle changes. They'll tell you, start exercising. But doc, it hurts, right? You're in this loop, this catch-22. So yeah, lose some weight, eat healthier, regular activity, do mind-body therapy. I don't even know if they talk about mind-body therapy. I'm not sure if they do. And then last,
Yeah, they tell you it's all in your head.
it's all in your head.
Yep, that's what they told me.
Yeah,
That's what they told me.
and then surgery.
For 5 years.
So let's say the joint has gotten so decayed, now it needs to be replaced. And it happens. It happens. I say least invasive to most invasive. We don't want you to get to that point. And I tell stories when I do my classes about patients that waited too long and they had to have surgery. They had to have back surgery. Yes, it breaks my heart, but sometimes it has to be done. 50% of the surgeries are successful. Now, 50 positive or 50 negative, whichever you see your glass half full or half empty. Within 6 years of having back surgery, you'll have a second one.
Yeah, that's what you were telling me.
6 years. That's the average. Yes. Crazy, crazy. So then, we take that inflammation. How does it affect us internally? So think about that. Give me some conditions that you know for inflammation.
Swelling.
No, I'm not talking external, I'm talking internal. So diseases, cancer, inflammation. I did a talk of cancer last October. It's on our website or on our YouTube. What's the #1 killer in the United States? Heart disease. All starts with inflammation. Inflammation of the blood vessels, inflammation of the heart. Now, this is where I'm going to step on some toes. I am going to step on some toes. So what happens is the blood vessels get inflamed, whatever reason, be it chemical, be it an emotional, the blood vessels become damaged and plaque builds up in those blood vessels and it blocks the artery. And then if it blocks it so much, what happens?
Heart attack.
Heart attack or stroke, yes.
Right.
So increased heart attack and stroke. But I'm going to go into cholesterol's role. And the drug companies love this. Love this. This is where you're not going to like me. We need cholesterol. We need cholesterol. What is the main thing we need cholesterol for? Not your heart.
Our brain. Right.
Yes, yes! I'm so excited. I wasn't sure they were yes, our brain. So when people are put on cholesterol medication, what happens? It affects
Thinking.
your thinking. Yes. Your Alzheimer's goes through the roof because your brain needs the cholesterol.
It's healthy fat.
It's a healthy fat. But I don't know how it all happened. We need it for our sex hormones. We need it for our libido. So men that are on cholesterol most likely will lose their libido. That's what happens because it has lowered the endosтерone. It regulates our blood pressure. Yeah, cholesterol regulates our blood pressure. So then you're put on a medication to help your heart so you don't have plaques, but then it affects your blood pressure. And then it depletes you of CoQ10, which is a nutrient, it's a vitamin that our body needs for our heart. So it depletes you of that. I mean, it's, again, this whole cycle. It repairs damaged blood vessels. So this was where I'm going to read from Dr. Wolfston. Let's see, where do I want to go? This gentleman has a book. Cholesterol forms all of our sex hormones, testosterone and estrogen, progesterone, our energy hormone called cortisol, for blood pressure regulation. So again, so many different things that cholesterol does, and again, we have to embrace how important it is. So cholesterol is such a critical component. A lot of people consider it almost like a Band-Aid because it repairs. But when you're on cholesterol medication, your body can't repair. Yep. And so cholesterol is part of the whole process of coming to the rescue and patching up that damaged area in the blood vessel. But it really was inflammation and oxidative stress that was damaging the area to begin with. So then it talks about the triad, the high LDL, the low HDL, triglycerides, because even though you and I, we don't demonize cholesterol, we still can look at just a basic lipid panel and get an idea of somebody's metabolic health and level of inflammation. So I remember the numbers have changed over the years, right? What was considered acceptable was 240. That was the number until the 80s, and then they dropped it. Guess who dropped it?
The government.
Drug companies.
Ding, 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 ding. Yes. They said, oh, we should put it down to 200. More people will be on medication. So the statins, controlling diet. A study I read, for men that have cholesterol at 150 or below, and that's where they want to get you to, the incidence of suicide increases. I couldn't believe it. In men, just in men. It's like, because where is it affecting?
The brain.
It's affecting the brain.
Wow.
Wow. Yes. Do I need to blow up the balloon again? It could get really big. I will in a little bit. What is metabolic disorder?
Obesity.
Yes, that's part of it. Diabetes. Metabolic. Phew. This is on the rise. On the rise. 11% of the population has diabetes. 11%. And it is rising in children. Processed food.
Yeah.
Processed foods. Inactivity. Not getting out in the sun. Type 2, most prevalent. Again, 55. I got one more year. And then it's all going up. Yeah, right? I didn't say it. What are the risk factors? We know the risk factors. Obesity, sedentary lifestyle, poor choices, our diet, our processed foods are going to wreak havoc on the inside of our body. Not enough veggies and the correct fruits. I'll go into that. So inflammation precedes diabetes. Have you ever heard of that? Most people don't realize that again, starts with inflammation in the pancreas. So I'm going to read, what is diabetes? Diabetes is a metabolic disorder where the body's ability to regulate blood sugar, our glucose levels, is impaired. So what happens when we eat a carb or we eat sugar, our pancreas says, okay, I got to dump some insulin to counteract the sugar so that it creates a store that can be used later for energy. That's the whole process. So sugars, glucose is energy for our body. So insulin is the hormone that helps glucose enter the cells to be used. With diabetes, either not enough insulin is being produced, or the body cells don't respond anymore to the insulin being dumped. So what happens is, sugar. How much sugar should we have in a day?
None.
We do need glucose. We do need glucose for our brain. We do need it for energy. We still need good sugars. Actually, the American Heart Association, I had to just look this up, says 6 teaspoons a day.
Ooh.
So I know, I was like, that's a lot. So 25 grams or 100 calories of sugar. So I'm going to ask someone to look on their phone, and I want someone to tell me how much sugar is in a can of soda. I won't say a brand name.
54 grams.
Oh, it's over a cup. It's a lot.
It's a lot.
Yeah.
39 grams.
39 grams in a can of soda.
That's equivalent to 10 teaspoons.
10 teaspoons, 1 can of soda.
12 ounces.
What's in a Mountain Dew?
Oh.
They're all right.
yeah.
Well, and that's
I thought that was
energy.
the worst.
Yeah,
That
that's
is
what I
energy.
thought.
47 in Mountain Dew.
Yeah, that's
Because I
So you think children's bodies are inflamed?
It upsets me when I see a child drinking Mountain Dew.
Yes. So then it's chronic, becomes chronic inflammation. So the mechanism, the body can't dump enough insulin to put it into stores. And if it's too much, it turns into fat. And the body's thinking, oh, I'm going to use this later.
And you don't.
And then you don't. It never does. Exactly. So then the complications, it affects everything. It's not just your sugar, it affects your nervous system. It's overstimulated. Diabetic neuropathy, numbness in those feet, nerve damage, kidney damage. They're always looking at the kidneys. Heart disease, fatty liver, all of this precedes that diagnosis, or could go in correlation with that diagnosis of diabetes.
What about the natural sugar in fruit?
I'll get into that. That's why I said ripe fruit. So noteworthy, you asked about gut. I am doing a gut health class, leaky gut, healthy gut. Our immune system is in our gut. That is in August, but all these doctors, every one of them, sleep, 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 sleep. Do you think we need sleep?
Yes.
Yes. How many hours? 8. But all can relate, right? As far as your sleep cycles and sleep schedules. So I did a class on sleep on our YouTube channel last May. We're going to talk about healthy gut. Hormones. Hormones control everything. I might have done a hormone class the year before. I did a cancer class. All of these are inflammation. And stress and emotions, I'll be doing that this October, and especially with the younger generations. COVID killed them. COVID killed them emotionally, being isolated in those pivotal years. So I'll be talking about that. But please subscribe to our YouTube channel. Yes, this is a plug. Subscribe to Healing Hands Chiropractic YouTube channel. There's so many good things on there. So your body whispers before it screams, right? So let me tell you some stories. Let me tell you some stories. Am I go there? Yeah. Let me go into chiropractic and then I'll tell you some stories. You're in a chiropractic office. You're here. Most of you are patients, so you need to be on, everybody needs to be on a chiropractic care. Everybody. I know it's like you tell people, you plant seeds, you tell people. It's life. Chiropractic is life. It reminds me of, I love Ted Lasso. I love the TV show Ted Lasso. It just makes me laugh. And one of the footballers goes, football is life. And it just makes, chiropractic is life. Why? We want to get to the cause of your issue. We want to not put the Band-Aid on by giving you a medication or telling you to take an aspirin. We want to get to the cause of the issue. And then remove that interference, that subluxation. When that bone's out of place, putting pressure on the nerve, stopping the communication between the brain and the body, it's dying. They call the subluxation the silent killer because it's slowly killing you or people you know. So it reduces stress and wear on those joints. From there, the body's going to start to heal. The inflammation's going to become less. Then it's going to adapt to the environment. Your body learns how to adapt. It knows what to do because now communication's happening. It knows where you are in space. It knows where you are. So then neurological function returns. Your body can heal the way God intended it. The power that made the body heals the body. We're given that ability when we're born to heal. When was the last time you thought about healing a cut that you had? You didn't, because your body knows how to do that. Long-term correction. I have patients here that have been here a long time. I love it. Makes me so happy. We've been here 23 years this year. 23.
Congratulations.
Thank you. And who does not want to live their best life? There's a purpose you're here. There's a purpose you're getting this information and watching this information. You want your best life. You want a better quality of life. So who do you know that needs to be in here? Yes, I'm plugging chiropractic, but this is life. A couple hours ago, my little Joy was here, my granddaughter, 15 months. Like I said, I was there when I watched her be born and watch what that lady did to her neck, and my heart just went, oh my gosh, her neck. And so 6 hours later, I was able to adjust her. I was able to get my hands on her and adjust her, 6 hours old. But I think of the thousands of children that are born every day and don't have that advocate for them. You're the advocate. You're the ones that are telling. And so, if I never adjusted her, who knows what could have happened is when they twisted her neck. Ear infections, right? That's common in infants. Acid reflux. Ugh. Ugh. I have an infant that I am taking care of right now. He's 10 weeks old. Since he's born, all he's done is cry. The mom is beside herself. Cry all day long unless he's sleeping. 10 weeks old, he's on an acid reflux medication already. Couldn't believe it. Because he was projectile vomiting, and they thought, oh, it's the acid reflux that's keeping. He cries all the time. So I've adjusted him twice. I'll probably see him tomorrow. Everett, little Everett. And I got him, and that's what we do. You calm down after the adjustment. And I told her he's going to poop a lot. Oh, sure he did. He pooped a lot. Still cried, but it was a different cry. I'm like, I'm okay with that. So I've adjusted him twice. And like I said, I haven't seen him since, but they've accepted care and are coming in. So I'm so excited to watch this 10-week-old baby's life change. I mean, that is just joy for me, and what an honor to be able to do that. And people trust us. When we were in Guatemala, we're seeing, I mean, thousands. We saw 3,000 people in 3.5 days. There were 13 chiropractors. 3,000 people we saw. They would just hand you their infants. Like, knew nothing. They didn't even know who we were. We're setting up in a town, and we're adjusting, and they're seeing people getting popped and manual manipulation. I'm doing activator. But they hand you their infant. They hand you their child. Trust. We're so jaded here. We're so opinionated. Trust. Trust. So, nutrition. You know I was going to talk about nutrition. You know that. Because what we put in, the fuel we put in, is going to affect our outcome. If you had a brand new car, and it wasn't a diesel car, would you put diesel in your car? What's going to happen to your engine? Nothing, right? It's going to seize up. Well, if we don't have the right nutrients in the fuel, our body seizes up. So, throw out to me. What should you be eating?
Avocados.
Avocados.
Salmon.
Tuna.
Eggs.
Olive oil. Talk about fruits.
Green pomegranate.
Pomegranate.
Berries.
Berries.
Kiwi.
A kiwi. Yes, we have kiwi. Berries. Berries don't increase your blood sugars.
Spinach.
Spinach.
Green.
Organic.
Green
I'm gonna organic.
Apples.
Yep.
Organic apples.
Organic. Let me go over. I mean, you see all those good things there. when you get an opportunity, look up the Dirty Dozen.
Yeah.
The Dirty Dozen. What's the Dirty Dozen? Yeah, I know, a TV or movie. Right.
Pesticides. Yeah.
Pesticides. These are the fruits and vegetables you need to eat organically. The pesticides, I mean, the government tells you you need to eat these organically because the pesticides are so high, they're going to be toxic to your body. You ready? You get it right? Strawberries.
Can't have strawberries.
Organic.
Organic ones.
Organic. These have to be organic. Spinach. Kale. Kale. Kale's good for you. Grapes.
Organic grapes?
Hard to find. Hard to find.
We just got them at Acme.
Yes, grapes are going to increase your blood sugar, yeah, more than the berries. The berries aren't going to.
Does
Peaches,
it matter if they're red or green? Does it matter what color the grapes are?
Red or-
I don't know. I don't think so. Because the,
Polyphenols more in the dark skins.
yep, the polyphenols, the anisinomides, yes, are in the red ones, like red wine.
Okay. You said peach?
Peaches, pears, nectarines, I'll slow down, sorry. You mentioned it. Apples.
Apples.
You want green apples because they don't raise your blood sugars. The other ones are going to raise your blood sugars. You'll have spikes in them. The green apples will not. Peppers, bell peppers. So the red, green, yellow, I know.
They have to be organic.
Organic. And you can get these at Food Line.
Yeah.
You can get
Yeah,
these
yeah.
at Food Line.
Just pale in one.
Yes. Cherries.
Those are
Those are, I've never seen, unless
I've never seen
in a organic food market. Blueberries. Those you can get at Aldi. All the berries you can get at Aldi, organic. Green beans. I know, green beans. What do you grow in your garden?
Tomatoes.
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 Yep.
I thought that was a nightshade. I thought that was an
I know,
inflammatory.
yes, you are correct, yes. I'm not going into that. And celery.
Yes.
Yeah, needs to be organic.
And lettuce.
Because the pesticides are causing more inflammation in your body. And they're foreign, your body's gonna fight that.
What about that Eat Clean, that advertise on television, this is spray that you spray on?
I have a spray as well. I use the spray. The best thing as well is vinegar. Soaking your vegetables and fruits in vinegar for 20 minutes.
Straight
What about the
vinegar?
lemon oil with
water.
the white?
Yeah.
I use that.
The white vinegar, yep. You can dilute it, yep, you can dilute it, yeah, because otherwise, yeah, your fruits are not sugar.
Well, when you
Yeah, but I
drink
have the
water.
spray, I do the spray as well. So, stories. This is huge for a number of my patients. Huge. Diet. So you think you're doing the right thing. You think you're eating the right foods and organically, and then all of a sudden you're like, I just don't feel right. I feel bloated. I ache, my joints ache. Well, I have a lady that was under care for many years, doing great, and then she came in and she's like, I can't lift my arms anymore. I can't put my arms over my head. Ached everywhere, was tired. And said, this sounds like you have food sensitivity. You have food, not allergy, sensitivity, that certain foods you're eating your body doesn't like. So we did a food sensitivity test on her. Eggs were off the chart. Eggs. You think eggs are good.
Yeah.
Her body doesn't like eggs. Doesn't like wheat. Dairy? No dairy.
Strawberries. Salmon that I don't even eat.
So we eliminated those things from her diet and we started healing her gut. And it transformed her life. What did you say?
Amazing.
What did you say? It took a long time. This is
About a year
this
and a
is-
half.
Yeah. I mean, this is years of toxicity inside inside the body. So testing is key. Knowing what, because, well, yeah. You don't want to tell your story. So sometimes it's good things.
What is it? Is it a blood test?
It's a blood test that we do, and it looks at 96 different foods, one of them. The other one looks at 40, okay, no, there's a 4 in there. Inhalants and foods you wouldn't, kumquat. I don't eat a kumquat, but a kumquat has similar properties to a lime. Ah, you squeeze lime in your water, you think you're doing something good. So finding out where that inflammation is coming from.
Seed oils are also bad.
Very much so. So what are seed oils?
Like canola.
Canola, yes. Vegetable oil. You think, oh, vegetable oil, it's what? No, it's processed. Gotta be careful of avocado oil. You also gotta be careful with olive oil. Because you don't want to cook with olive oil. It denatures it. It changes the makeup of it. So you can do it raw, like, salad dressings and on top of things, but not cooking with it. So what do you cook with?
Butter.
Coconut, ghee, Ghee, and butter.
Butter.
That's it. Those are the things you should be frying or cooking
Well,
with.
butter's good for you, but they make it sound like butter's bad for you, but margarine's horrible for you.
Margarine's horrible.
That's why I like butter.
Yeah.
So, then I'm going to talk about God's nature, God's plants. That's your roller bottle. We're going to talk about essential oils. So, what are essential oils? They are highly concentrated components of a plant. Lavender. When you hear lavender, what do you smell?
Flower.
Flower, but what is it in your mind? What is it? Relax. Calming. Yes, calming. But it's highly concentrated. You don't need a whole lot because it's extracted from that plant. So it can be used aromatically, topically, or internally. It boosts mood. I have books and books and books on essential oils. I used to do only essential oil classes. Sleeping, killing foreign organisms. I'm talking about bacteria, viruses, fungi, reducing inflammation. So there's a whole list of anti-inflammatory oils, whole list. I'm giving you some of the highest in your roller bottle. So let's talk about them. Turmeric, right? Anti-inflammatory. Turmeric. It's neuroprotective. It helps the cells. It helps heal the cells, the nerve cells. Copaiba or copaiba. So this works on the cannabinoid system. It's not a cannabinoid, so it's not a hemp it's not a marijuana, but it works on that system, our cannabinoid system, which is our emotions. That is highly anti-inflammatory, but it's analgesic. It numbs the area. It numbs it. High antioxidant. Bergamot. Do you know what bergamot is?
Orange.
No,
It's
but
an orange derivative.
yes. What tea is it?
Earl Grey. Earl Grey?
Earl Grey is bergamot.
Yeah.
Earl Grey. It's for arthritis. It's it's in your roller bottle. Did you get a roller bottle? Yes, it's in your roller bottle. Digestive stress and frankincense, the king of all oils. For everything, frankincense, brain health, brain injury, memory tissue repair. So that is your roller bottle. You can put it on the back of your neck. Put it on the back of your neck. Put it on your wrist or behind your ears. The future is what you created it. Do something now. Do something now. So, does anyone know their inflammatory number?
There's a number?
Yes. There's a test. It's a blood test.
Mine was good, I can't remember the number.
But it was good. It was good. So,
It was under 200.
we look at, it's called C-reactive protein.
Oh.
It's a protein that shows up when there's inflammation in the body. It's produced by our liver, and it is part of our immune response. Now, Ours is sensitive, histologically sensitive. We're looking at the tissue level when we test. And then, how many times at nauseam do I talk about vitamin D? Everybody needs to be on D3 with K. Everybody. But the range is so big. You go to a medical doctor and it's from 30 to 100. 100's the range, and they think, oh, you're 30, you're good, get your vitamin D. Oh my gosh, no! Thousands of research papers. You need to be between 60 and 80. And then if you get close to 80, they're like, oh, that's too high. We don't know what to do. No, it's great. I have patients that are over 100. I tell them to cut back. Yeah, you can cut down on your vitamin D. So normally our test is 320, but if you are interested in finding out what your vitamin D number is, if it is not in your care plan, within the week, you don't have to get tested now, but say, I want to get tested. I want to know what my inflammation and vitamin D is. We will do the 20% discount, so $64 off of the test. If it's not within your care plan. I know some of you it is, others it is not. And then we'll tell you, okay, what are your numbers? Most people are very low in their vitamin D. Most people are very low.
Is that CPR or blood test?
It's a blood stick,
No, I mean,
CRP.
is it something the labs do?
Not the sensitive one, and they have to be a reason to do it. So it's not, and neither is vitamin D, part of the panel.
No,
Like,
no,
yeah,
okay,
that's
yeah.
a special, you pay for that out of your pocket.
Right, okay,
You're gonna pay for it out of your pocket either way.
okay.
So what's your next steps? Start small, start changing that diet, start small. I know it's like, how do you eat an elephant? One bite at a time. Thank you. Remove processed foods, remove sugar. Introduce the healthy fats. Start supplements. Everybody needs to be on D3 with K. If we go out in the sun, what do we have on our skin? Sunscreen. So we're not absorbing the D. But it depends on your number. How much do you need to take? Fish oil, omega-3, or the omega-3s, Eflamex or Inflammatome. So taking those supplements. I know you have questions. Talk to us. We have an assessment you can do online, so we know where to start. We don't know where to start with you. Schedule a wellness consult with myself. Our next workshop is in June, healthy aging, agile aging. So we're going to talk about mind and aging and fall prevention, that fun stuff.
What is the E-flame again?
That's an anti-inflammatory, it has turmeric in
Oh,
it.
turmeric, okay.
It has turmeric, it has frankincense in it, and it has white willow bark, which is the precursor to aspirin. So those three things reduce the inflammation. Everyone knows Maya Angelou, right? We want to thrive. All right, guys, here we go. Can you open that for me? Close your ears. You ready? You don't want that to happen. You don't want to blow up. Let's take care of that inflammation.
Thank you.
Really?